thank the kind invitation of Professor Bienheke. I want to thank the distinguished officials and professors. And I also want to thank the unacknowledged distinguished people in this audience, because you will make the changes. Now, very briefly, and I know I'm very pressed for time, I want to submit that rational medicine of any sort cannot allow prejudice. And if you have a belief that is not supported by rational medicine's data-driven process, you must abandon that belief. Any words be better. He said in a book called Guide to Health 100 years ago and more, vaccination is a barbarous practice and one of the most fatal of all delusions current in our time. Conscientious objectors to vaccination, which should include doctors, should stand alone if need be against the whole world in defense of their conviction. Regulations are made by regulators and they flow downstream to public health officials and then to medical administrators and then to clinicians whose clinical decisions are based upon the regulator's decisions. Theoretically, public health and clinical decision-making should be, must be, and we assume is informed by science and resource management. In reality, that's very often not the case. Corporate, multinational, and financial interests drive those regulations to an enormous degree, more than most people ever think about. And that leads to criminal behavior on a personal and on an administrative and governmental level. Now, by nature, every regulatory decision is flawed because the data set is necessarily incomplete and new data is constantly arriving in the sort of way that we're used to and in the new integrated paradigm that we're creating here and in other places like that. National and personal health rests on effective medical education, which leads to good regulatory decision-making and good clinical decision-making. But regulatory error, as I have suggested, is absolutely inevitable. Resultant human suffering will drive new regulatory decisions in a fair system. Suffering is increased when data and decision-making are skewed by lies, like vaccines are safe. Cross my heart, I promise. When doctors, for instance, don't vaccinate themselves, or their nurses, or their families, but they vaccinate you. Corporate and governmental corruption drives those decisions, sometimes consciously, sometimes unconsciously. The results are a waste of resources. Criminal behavior, as I have said, unacceptable human results, morbidity, and mortality. Physicians are marginalized in this whole process, and the public pays the price through chronic disease, preventable suffering. No nation, rich or poor, should bear that price, and no person should bear that price. I'd like to use vaccination as my example. The examples could be taken from any area of medical decision-making. I chose vaccination. Before it can be deployed, and by the way, my experiences with the United States situation, but the United States casts not a huge footprint in this case, but a huge syringe print on the issue. Before it can be deployed in the United States, every vaccine by law must be shown to be safe and effective. Public health measures, of course, including vaccinations, should be cost-effective. Are vaccines safe? Are they effective? And are they cost-effective? Let me show you the number of vaccines deployed in the U.S. and therefore worldwide, which have been proven to be safe and effective. Let me show you the number of vaccines deployed in the U.S. which have been proven and shown to be cost-effective. It's an identical number. In the United States, vaccine manufacturers profit from development grants from the government, prepayment for vaccines that are never produced, total legal indemnity. No matter what happens to the populace that receives the vaccine manufacturers are totally non-responsible for any liability. Downstream profit centers. Now those include cancer and leukemia, like the SV40 vaccine virus, the leukemia virus, known to be found in polio vaccines and others. Infertility, polysorbate 80 and tween 20 are infertility agents in very, very large numbers of vaccines. They have no purpose for being there in terms of the vaccine, other than downstream profits. Autism, yes, autism is caused by vaccination. That's another talk. If you invite me back, I'll be happy to give it. Alzheimer's disease, and many, many more. They're profit centers, ladies and gentlemen, nothing more. Few topics engender such outrage and indignation as vaccination. USA Today, a major newspaper, suggested that we jail all vaccine skeptics. That would be me. The Guardian says, silence vaccine skeptics, don't give them space to share their information or thoughts. The New York Times says the same. U.S. regulations are already in place to incarcerate people until they accept voluntary or involuntary vaccination. I have published those on my website, which is www.drrimatruthreports, DRRINA-truthreports.com. Do vaccines prevent disease? Do they prevent childhood diseases? Do they prevent meningitis or smallpox or polio? The answer is clear, no matter which disease you consider. For example, let's look at childhood diseases. This is a graph, a very important graph, that shows the decline of 3 common childhood diseases before vaccination. The first bubble toward me is diphtheria vaccines introduced. The decline was sharp and dramatic before the introduction of the vaccine. The next bubble, over toward my left, is pertussis, whooping cough. The decline had been almost total before the introduction of the vaccination. And measles, even more dramatic. I'm going to talk about child mortality for a moment in England and Wales because the statistics are very clear. The experience is the same elsewhere. Between 1850 and 1940, the mortality had dropped by 90% for infectious diseases, including scarlet fever, for which there is no vaccine, diphtheria, pertussis, measles. First diphtheria vaccine came in the early 40s. First pertussis vaccine, early 50s. First measles vaccine, late 60s. The deaths of children in England and Wales from scarlet fever, diphtheria, whooping cough, and measles can be seen here. The steep decline, and then the actual interference in the decline from the introduction of mass immunizations. Very interesting. Annually, England and Wales whooping cough mortality dropped by 1953 when the whooping cough vaccine was introduced by 98.5%. What public health problem, at least in England, Wales, and the United States? You can see the graph. Measles mortality went from 1,100 per million in the mid-19th century to virtually zero before the introduction of the measles vaccine. You can see the graph. Smallpox is a little different. Smallpox mortality declined steadily from 300 per million to virtually zero in the 60 years post-1850. But when the British government enforced the rules that they have passed, the smallpox vaccination requirements, here's what happened. 275% increase in smallpox mortality, specifically because of the smallpox vaccine. In Australia, 2/3 decline in infectious childhood diseases between 1881 and 1971 before immunizations were introduced. There's the graph. This is the top yellow box shows that the mass immunizations began, and you can see that the decline was interfered with. In the U.S., tuberculosis and typhoid infant mortality declined despite the fact that there was no tuberculosis vaccine available and there was only an ineffective typhoid vaccine. You can see the graph. The top line is tuberculosis. The bottom line is typhoid. Respiratory tuberculosis mortality in England and Wales dropped by 87% prior to the introduction of antibiotics in 1947, and then a further 93% before the introduction of BCG. And you can see the graph. Vaccines, ladies and gentlemen, do not prevent disease. Diseases are prevented by hygiene, clean water, adequate nutrition, and immune support. Do they eradicate diseases? Vaccines, of course. Let's look at smallpox and polio, the shining stars of disease eradication. Smallpox first. The last smallpox case was found in Somalia in 1977, according to WHO. No new cases after 1978. But have smallpox and polio really been eradicated? Take a look at this astonishing and unbelievable graph, and there's good reason not to believe it. You see the number of countries reporting smallpox cases declining, and then you see it plummeting. Well, there's a good reason that no smallpox cases have been reported. It's because the name of the disease has been officially changed to monkeypox. We don't have any more smallpox, but we've got monkeypox. Monkeypox was identified in 1970. It's clinically indistinguishable. The New England Journal of Medicine examined the pathology specimens, including DNA, of 511 cases of monkeypox. Virtually all of them proved to be smallpox. But politically, we've eradicated smallpox. Smallpox is a political football. Larry Brilliant, MD, I'm sad to say he was a classmate of mine in medical school, intentionally created this confusing deception for the WHO so they could score a big goal and promulgate vaccines. WHO is a private corporation, ladies and gentlemen. It is not a humanitarian organization, and it is funded by Big Pharma. Polio incidence has declined 99% since the eradication efforts began in 1988. India, as you know better than I, was declared polio-free March 27, 2014, to much fanfare. But there's another story, and that story is non-polio acute flaccid paralysis. It's twice as deadly as the wild type, and in the 13 months prior to being declared polio-free, in your country, 53,363 new NP-AFP cases were diagnosed. The vaccination rates and the rates of NP-AFP show a direct positive linear correlation. Absent polio vaccination, your national rate of polio was 2 per 100,000. With polio vaccination, your national rate is 13.7 cases per 100,000 children. Polio vaccination rate is highest in Uttar Pradesh, I hope my pronunciation is acceptable, and second highest in Bihar, where NP-AF incidence is 34 children per 100,000 in Uttar Pradesh and 21 per 100,000 in Bihar. It is indistinguishable, as I said, from polio, and it includes the presence of the polio virus, thanks to your friends. NPASP is polio, in the same way that monkeypox is smallpox. Vaccines do not eradicate diseases. Politicians eradicate names of diseases. Diseases are eradicated by hygiene, clean water, adequate nutrition, and immune support. So, are vaccines cost-effective? Every vaccine examined closely, and we have examined many, has enormous direct and hidden costs associated with it. No vaccine, as I said, in the U.S. has ever been shown to be either safe or effective. And those vaccines are deployed here, or cheaper, even less safe versions are deployed here. Chickenpox vaccine provides poor protection, so booster shots were added. There is no scientific validation for the use of a booster shot. When a vaccine fails, the Advisory Committee on Immunization Practices of the CDC says, well, add a booster, adding to the burden, many kinds of burdens. Booster shots are nonsense. Varavax, the chickenpox vaccine, increases shingles cases in children and in the elderly. The excess cost of shingles just in the elderly, just in the United States, is more than $700 million per year. Total, the excess cost of shingles and other adverse events is over $1 billion a year. And that all goes into the pockets of big pharma, who are happy to generate the profit center on your backs, your bodies, and your children and mine. CDC's advisory, I am racing, but I really will do the best I can. CDC's advisory committee continues to recommend vaccines and booster shots at a horrifying rate. Influenza vaccines, for example, like pertussis, measles, chickenpox, meningitis, the ACIP recommendation is for their use absent scientific justification. This year, CDC admitted the flu vaccine doesn't work, but you should take it anyway. The United States government this year will collect over $100 million in fees for the administration of the vaccine if the schedules are followed, just this year. Meningitis vaccine is an atrocity. First of all, it doesn't work. I'll skip through a lot of this. Second dose for college freshmen and all 16-year-olds, the cost per dose is about $150 U.S., and there are totally unsubstantiated claims of its effectiveness. Assuming 100% coverage rate, the mass vaccination program for meningitis would prevent less than 57% of the meningitis seen annually in the U.S. The average cost is $600 million U.S. per year, just ignoring the second shot. So the current cost exceeds $1 billion per year. Before the vaccine approval, there were 1,360 cases of meningococcal meningitis in the U.S. By 2008, 4 years after approval, there were 1,170 cases. That's a reduction of at most 190 cases. The cost per case reduced in the United States is $1.4 million, straight into big pharma's pockets. Mortality of this disease is at most, at least in the U.S., 10%. 19 deaths were theoretically prevented. The cost per theoretically prevented death, $14 million U.S. The CDC says no, it wasn't 19, it was 9. So the cost per prevented death is $30 million U.S. However, those rates have declined. And if we include the cost of adverse events, using the most industry-friendly numbers, we see that the serious adverse events Reported were 20 deaths, 98 life-threatening adverse events, 49 cases of permanent disability, 3,007 hospitalizations, 19 extended hospitalizations, and 2,400 emergency room visits. Thus, in the U.S., to save 130 meningitis infections and about 9 deaths annually, we have created more than 66 deaths. Remember, 9 deaths, 66 deaths from the vaccine, 161 disabilities, 312 life-threatening events, 1,006 hospitalizations, 7,900 emergency room visits, downstream profit center. Closely examine every vaccination program, and I will be happy to provide you with the data of these examinations. It's at least this bad. Many, like the HPV vaccines, are far, far worse. Regulation based on commercial interest creates ongoing, preventable tragedy of unthinkable magnitude. Irresponsible regulatory decisions are made on the basis of financial and personal emoluments and the acceptance of politically and commercially useful pseudo-science. Absence of rigorous, independent replication of claimed tests and trial results is disastrous. Applications for vaccines in the United States are permitted to basically lie, say anything they want. Nothing is substantiated. Everything is accepted. I will skip to the end. Applicants are not required to study any in-use performance of the vaccine or delayed adverse event reaction patterns, and they're completely exempt from any liability. The applications are rubber stamped by the ACIP of the CDC, and every member of the ACIP and every member of the FDA's panels that advise on whether to accept this or that material, medicament, or biological, everyone has serious personal and professional conflicts of interest. The system could not be more broken. When a vaccine fails, as I said, they add the boosters. Cui bono, who profits? In addition to direct and hidden vaccine program costs, vaccine manufacturers profit from, as I said, many other streams. Solutions do exist. Safe, simple to use, scientifically validated, cost-effective material will prevent all infections. Professor B.N. Hegde was responsible for bringing this miraculous safe nutrient to India. It is made here. It is available. There are more than 1,000 scientific studies saying how effective and safe it is. It is a nutrient. It is self-sterilizing, totally non-toxic, and can be used by any and every member of the community safely. Totally cleared from the body. I have 2 questions to ask you in the time which I have now exceeded. First, what would be the consequences for India if the money wasted on vaccines and adverse events, if that money were used for better hygiene, water, food, and the study of traditional options? What if every home in India had a 250 cc bottle of nano silver 10 parts per million and people knew how to use it? And what if infectious and parasitic diseases were completely eliminated from India, completely eliminated through this simple nutrient? Finally, what would it mean for India if her health were in India's hands?